Hey, Todd, thank you for coming in. Yeah, and you're doing some marvelous work as CEO of Seed Healthcare. You got your podcast and things like that. Definitely traveling around the world and transformational investments and, making all these wonderful contributions. And you got a great story arc as well. So thank you for coming in and sharing your insights with my audience.
Glad to do it, Stephen. Thank you for having me on. I've watched many of your podcasts, and our conversations have always been interesting and exciting. So I'm glad to be here and looking forward to the conversation.
So Todd, you got this wonderful career. It's continuing, servant leadership, massive contributions, doing investments. Yeah, it really a very multi-dimensional matrix, like a cloud of contributions, and it's continuing. So what were those, three inflection points in your life that made you who you are today? And it could have been 3 or 5 years old. It could have been as a teenager. It could have been challenges inside outs of the family. It could have been education, mentors, early career moves. What were those three really transitional moments for you?
It's a great question, and I'll tell you, I always break things down in threes, so that works really well. It seems to be a good habit for successful people. The the progression of my career is an interesting one. The first time I walked into the operating room when I was in my early 20s to actually interview for a job with J&J, I'll never forget it. It was a fascinating moment when a woman was in there having a facelift, brow lift, and a blepharoplasty. I'd never seen a surgical procedure before, and they were doing what I would call what I learned later was a pass out test. Does he hit the ground? Or does he actually, want to learn more and lean in? And I leaned in. I was all in on fascinated as to why a woman would have her forehead cut apart and put down to her, it was touching her chin. And I was like, why would somebody want to do this? And it was my first procedure. And I looked at it, I was like, okay, this is where I'm supposed to be. And I found that drew me into the clinical part of it. So I understood the decisions people were making with their healthcare needs. I understood kind of the clinical surgical component. And that was just a pivotal time in my career because I was teaching physicians how to do minimally invasive surgery. And it just totally gave me the mind's eye that I could influence the healthcare community and really drive change, because we went from taking somebody's gallbladder out with a big incision to a very micro incision. And at that time in the early 90s, that was a really fun time in the medical arena. So that was one. I'd say that got me excited about healthcare. It got me into the OR. It taught me the evolution and revolution that could happen with the transformation. It also taught me how hard it is to change in healthcare and drive that change, even when it's logical. So I'd say that was one. Two was the people that I was around in that ecosystem. It was some of the best surgeons in the world in my early 20s with DeBakey, and there was I'll never forget a oncologist who referred back to the days of when medicine was different and all this stuff, and now we've got all this video surgery. But what he said to me was also a turning point. It was an interesting comment because he said, if we just focused on manufacturing a healthier patient, then we would be doing better. If we focused on the logistics of that. And that resonated with me. And so if you go back, that was almost, hate to say it, 31 years ago. And that resonated with me, and it stuck with me today because we're still not doing that in healthcare. So that was another thing that kind of stuck. So that's two. And the third, my family had been struck with chronic illness at a young age. My mom had heart disease at 52, and I'll lump two together. My dad also died at a young age at 69 of late stage cancer diagnosis. So my reasons why and the story is not just because I want to live longer, but nobody should go with heart disease that is undiagnosed until you're up against a heart attack or at risk for one or have one, God forbid. No one should actually get diagnosed of cancer at late stage our bodies cover it up. But ultimately, with all the diagnostics and computing power, which you're more tech focused than I am, the computing power is helping us really be able to detect these diseases earlier. And nobody should die of a heart attack today without knowing they have heart disease. And 18 million people do a year. And that is tragic. So my why is lumped into all three of those things. And those were all three big kind of impactful moves in what motivated my career.
So I could see the clear ties in your interest in healthcare and healthcare investments, right? From seeing this sort of surgery and asking, well, that's really interesting, and being able to kind of drive your curiosity to, there's got to be improvements on the wellness side and prevention, and it's not just afterwards, and then of course, just looking at more kinds of efficiencies and being able to see things early. You shouldn't have a situation where people get surprised, because there's all the indicators are out there, the biomarkers or some of the other things that you can pick up through sensing, and that's reflected in everything you do today. Earlier, though, in your life, what drove the interest in the clinical side when you were in high school, let's say, or earlier, or was there an interest, or you have a financial background, investment background? Did that start when you were like 5 or 6 years old and things like that? And
good
your sort of pervasive curiosity and your agility and your resilience, where did that come from?
So, I'd say it had to start earlier. I was always driven, to go earn a living. And even at a young age, my parents said, "Oh, you want to buy a car? Well, go earn the money to go do that." I wasn't really handed anything. And so that drive kind of resonated in my career. I wasn't really fascinated with healthcare when I was younger. I didn't really see that as being my direction. When I first went to college, I was planning on being a lawyer. I had this thought process around logic and simplifying things, and simplifying the law was something I thought I would do really well. And I decided when I interviewed, 30 lawyers that were really not happy, not to offend any lawyers out there. They were not really excited about their job. I couldn't pick what kind of law I wanted to practice. So I then decided, general business and figure out how to engage people and simplify things, and started a sales career. And then that led to the medical device industry. I tell you, the curiosity for healthcare did not really get there until that first procedure. It really didn't. I was not a science person. I kind of wasn't diving into the frog dissection in high school, or in any of that. So really, I picked all that up later. But my thought process around finances and investing and all of that started in my younger years. With everything that I read, it was all about how to create financial independence and that mindset as a young person. And that kind of, when I got into corporate America and started working for US Surgical and then Stryker, I just saved my money and poured it into investments, both in real estate, finance, those types of things. So I took my healthcare knowledge and built on that. And that's how I continue to build in the finance arena and in the investing arena. So it kind of all ties together, but there was no, I wasn't a 5-year-old, playing surgical doctor or anything like that. So it's a good question though.
So yeah, but your parents made you entrepreneurial in those sense. It's like, you want that car, you better earn it. Right?
Yeah.
So you have to figure out a way to pay for it, right? And that made you curious about business and entrepreneurship and things like that, and finances, and it's interesting. You had this interest in law, but then you found that there are just kind of all these different kind of options, and you thought, you know what, that's not simple. That looks a little bit too complex. Let's break it down to something that's logically simpler. And you thought business would do that. And then you have these career options you took, like in sales, and like, in fact, it's interesting. One of the gentlemen that I interviewed just before you today, he indicated that he had an early sort of realization that's, in fact, he's studying engineering, but his engineering prof says, there's no point in studying engineering unless you know how to sell it. You got to be able to communicate it and stuff. So,
You have to make it simple, right? In healthcare, it's anything but simple. So I took I'd say when people ask me what one of my real gifts are, I often will say I make complicated things simple. And if you can do that and you can actually break it down, people can understand it. And you could take the whiteboard of how the healthcare ecosystem in America, which is all backwards, payer systems all messed up, everything's all messed up. And you can literally simplify that, then you can do some things and you can actually channel, real effective change by being intentional about it. And that's been one of the things that have helped me through my career. So it's been we'll call it the entrepreneurial nature of what my parents taught me. You learn some things about what to do from your parents by example, and then you learn some things what not to do. And in my case, I think I took some of the best parts. My dad was a very bright guy. He was a lawyer and a CPA, but he always worked for somebody else. And so that motivated me not to, right? And it taught me that entrepreneurial spirit and probably a little bit more aggressive risk taking that led me towards the path of starting my own company and doing all that. So it's as an origin story, it's an interesting path because, again, he was a wonderful man. And I learned a lot from him on both sides of it, how to be a great teammate, how to be collaborative, how to be a sweet guy. And it was, me learning some of the things that motivated me were also really relevant. So it's fun. I had a good childhood.
And then you have these inflection points in the healthcare area, which got you into that area. But you spent a decade in medical devices, over a decade at Stryker Corporation. So how did you first get hired? What were the things that you did for that corporation? And how did that further kind of drive your curiosity?
Yeah. So I was with US Surgical in my first job in medical devices, and that was in Houston. And essentially, I wanted to move back to Atlanta. I was born and raised in Atlanta, and I had family there and a lot of legacy there. So I wanted to get back to Atlanta, and I became very useful to US Surgical, and they wanted to keep me in Texas. So it became a situation where I was recruited by Stryker, and it worked and it fit. I was hired as a kind of a regional sales director in the market to fix a kind of a broken region for Stryker at the time. This was right in 1995-ish. And I quickly fixed it. I quickly turned it around, brought on the right team. And then they asked me in 1997 to work as solving problems for healthcare systems nationally, and run their consulting division, which didn't really exist at the time. And I jumped in. So I traveled around. If you remember, in 1998, the legislation was passed in 1997. It was the Balanced Budget Amendment, first healthcare reform in the U.S., and that created a bunch of turmoil for the healthcare systems. They were showing 2% margins, forecasting negative 15% margins. So they had to cut their costs, become more lean. So they put pressure on vendors. Stryker being a $5 billion company at the time, now it's 20 plus, I believe. And, they were a big vendor at the time. And so they asked me to fly around and do partnership agreements with all the hospitals to enhance their performance by reducing their costs and doing labor management, supply chain, and working with them as a partner as opposed to cutting our prices. So it gave me a very good lens into how a hospital operated, what the budgets were and how thin they were. And it kind of took me from what I would call the clinical side of being in the operating room to understanding really the operational aspects of healthcare, including the operations of a hospital, how they're paid, how they collect their revenue, why there are so many revenue cycle companies in the world. Like there's a million of them. And it really taught me a lot. And it taught me a lot about how to create efficiency in healthcare. So that was one job. I stayed there for another 6 years after that part. And I ended up working in a company called Stryker Communications, which was really an early adoption of robotic surgery and ORs of the future and integrating telemedicine into the operating room. And we innovated products, we innovated the sales force, we innovated every aspect and built that up to a several $100 million division from 2001 to 2004. And that was at 80% margin. So we built businesses. And then after that, I realized, that I had done as much as I could there. They asked me to move to Michigan or be somewhere else, and I just wasn't ready to do that. I had young kids at the time. And that's when I decided to become an entrepreneur in 2004.
Yeah, but there's a gap between that and founding Seed Healthcare in 2020, right? So describe that gap.
Oh yeah, it was a great gap actually. I started. It was a company called Healthcare Real Estate Advisors, and if you look at the labor management supply chain was the efficiency of the 90s. The third largest cost of every healthcare provider in the U.S., really almost anywhere in the world, is physical plant occupancy costs, and nobody was paying attention to that line item on the budget. So I created a company that did that. I built that from 2004 as a regional company, then grew it larger, and then ended up monetizing that and selling it and affiliating with Cantor Fitzgerald and Newmark as a banker real estate platform that did all sorts of strategic finance, capital markets, everything related to serving the providers in the healthcare real estate, finance, and M&A components of it. So we sold that business in roughly 2012. I stayed on there until 2020, really a little bit over that, and started Seed Healthcare in 2020 as my family office in Puerto Rico. So I subsequently left Atlanta, moved to Puerto Rico. I had a bunch of friends in Puerto Rico, and the tax haven there was very good for U.S. citizens. Things were remote, so I could do a lot of my work remotely, and I set up a domicile there, set up the family office, started looking at my investment strategies, and started investing in what I would call, well, I look at every category, but I started looking at late stage to early stage and everything in between, and decided where I could really help the companies grow and where my relationships would really help would be in that kind of early to middle stage where the companies were ready to really go to market and work with providers to make change happen. So I started investing in that area. That's really what led me to Seed and that direction, but that closes the gap. So 2004 to 2020 was all in the finance world around serving providers and adding value to that and helping them become more efficient capital-wise, monetizing different aspects of their business, private equity, capital markets, all of that. And we had a lot of success. So it was a lot of fun, actually, that also had a lot of impact to providers, which created all the relationships that I have. So it's been a positive ride there, journey.
Yeah, and then you have Seed Healthcare, and of course you're addressing all the major stakeholders and healthcare companies. So again, the capital strategies, which you've done, the integration of emerging technologies, which you've done, complex clinical revenue enhancements, which you've done in your past, and then you launch a fund. So talk about that.
Well, sometimes I look at myself and I wonder, why and all the reasons why. But if I go back to my origin story, those reasons why are really clear. And what I realized as I started to invest is that there were amazing companies that were not going to make it if I didn't help them grow. And so I invested in several companies. We deployed about $11-12 million from call it 2021 to 2023. And all of those companies we've done really well. And we've helped them grow. I can go through some of them, but the number one company that I'd probably bring up is Fountain Life, which is a very strong preventative care platform. It got me really building my thesis. I I constantly reflected back to that oncologist that was 74 and talking to me like I was a young buck, saying, we just need to get to a manufacturing process of a well patient. And I started to correlate that with what Fountain Life did. So it kind of is the whole process that came together through that journey from the beginning of my career all the way to adding the finance and recognizing the broken aspects of the break-fix model of healthcare instead of the proactive model of healthcare. Fountain was an investment I made that really I became very passionate about. It helped transform me in some of the physical attributes. And it actually helped me sleep at night around me not having heart disease, me not having cancer, my family also being healthy. And I started really driving towards that. And I'm still on that program. And in 2024, after deploying a bunch of capital, I started to realize my network wanted to get on board, people that I wanted to really come alongside and invest with us. And then I also had a whole group of leaders that I had met through my career that were deep into venture, that wanted to get involved in our venture fund and in our investments, and also help us make investment decisions. So the first few years was me making investment decisions and companies that I knew I could help. In 2024, I formalized a full investment committee. I knew I couldn't go as far as I would like to go on preventative care without having what I would call a real proactive professional IC and an IC investment committee. And then I also realized that my network of clinicians all wanted to get on board. So a lot of people think the change resistance is with clinicians. It's not. It's actually educating patients is difficult because they get a lot of misinformation. And then when you look at the payer model, that's really part of the problem. I would tell you 99% of the physicians are head down treating patients and doing their best. However, the idea of proactivity is not how the business is done, right? People come in sick. So if you're really looking to move the needle and kind of get to that manufacturing process, you have to have the physicians on board and you have to get their head up so that they can actually pay attention to the new technologies, the things that are enabling that can really drive change at the point of care. And so at Seed, that's what we really do. So we started a fund in the middle of 2024. We did a closing, or we're doing another closing as we speak, and it's not without its challenges. Fundraising is hard, but with the right thesis and the right idea of driving impact and actually impacting the companies you invest in, it becomes a much easier process. And that's kind of our thesis, Seed.
I mean, it's really fascinating because really it's a culmination of all of the past, different sort of roles you've played, and you've been in a strong leadership and all of that, a driver for excellence and execution, and you've got such a great history. And then to take this into an institutional fund and then saying, hey, I can even do more. And you've built this great network and other advisors, and they're on their investment committee as advisors, things like that. There'll be investors as well. And now you realize the value of preventative care and getting ahead of the game, and not this idea of sick care. So, and from these early interactions you had, right? Create this into a predictable process and make sure you get ahead of the curve. And you're investing in disruptive technologies to drive change in healthcare. Can you describe some of the areas they're really interested in and where you think, you know what, this is where it's going, and then maybe get into some case studies if you can, or maybe not, but yeah. I don't know if you can.
Yeah, 100%. I can use an example of a company that we invested in last year. It's called Genelite. If you remember, over 10 years ago, Theranos was a bad word, right? They blew up and then people went to jail and all of that, and they made movies about it, right? That was basically a great idea where you had point of care lab testing at the access point where the patients were interacting, and they could do it real time, fast, and diagnoses happen all the time without information. So lab testing is something that we feel very, very strongly about that needs to be at the point of care. We found a company a couple of years ago that's called Genelite. We actually invested in that last year, as in essentially that company has a lab in a box that's about refrigerator size tall that you can drop a tube of blood in, and it will run a full metabolic panel in under 30 minutes at the point of care. The AMA came out with reasons that you should actually have your labs in hand when you're with your doctor. So they're trying to get that done, but that just doesn't happen all the time. They typically send it out to Quest or LabCorp or other companies, or they may have their own lab, but it doesn't get done in 30 minutes. So they either have to get their labs away early or do something different. CMS also put out, that's the billing agency in the US, it put out mandates that if you have labs in hand, you can actually bill more. So the physicians can actually bill more if they're reviewing the labs with a patient. Most of the time, when I used to go to the doctor, I would get labs received and I get a call from the nurse. They say, "Oh, you're healthy. There's nothing to worry about." I go, "Okay." And I would go on about my business. I didn't, even though my cholesterol was high and I talk to a doctor about it, right? Like they never were really looking at my data with me. And I think that Genelite is a good example of one that is changing how care is delivered at the point of care. And instead of inferential medicine and a guess of what you have, we're able to review blood tests and results really at the point of care. And that's not been done really before. I would say there's a lot of other things like the power of data. And if you look at computing power, and if you look at computing power, would you have a human read your X-ray or MRI or CT scan, CT angiogram? You can, and they will write a report and they'll say, "Oh, there's a ballpark of this much blockage in this artery." And, they'll write a general report. But what they won't do is say there's this micromillimeter blockage and stenosis in your artery. And there are 5 technologies out there that if you have a CT angiogram, you can put an AI overlay on it, and you can look inside your arteries without being invaded into your artery. No surgical procedure, just simply contrasted CT, and take a little X-ray on, to a little radiation on, very little. So you think about that. Well, that totally can eliminate the risks of heart disease, or say you've got to work on it, and then you have the potential of reversing it, right? So I have a CT angiogram every year. I can give you the list of tests that I have every year. And, if anybody asks me, I'm like a completely open book, because you want to eliminate the big risks. And a blood test is one of those. So the lab in a box technology spoke to me about that. You need a full comprehensive blood test with biomarkers. You need a CT angiogram, especially if you have heart disease in your family, or risk of heart disease, or high cholesterol, or any of those things. Plaque scores don't really mean anything anymore unless you really look in your arteries. I would say a full body MRI is definitely, and brain scan is definitely useful for metabolic health, brain health, body composition, aneurysm risk. And the key is to eliminate 90% of the big risks that kill people are those: metabolic health, heart disease, cancer, brain health, and you can eliminate those today. Those are the things we focus on. That doesn't mean we just invest in diagnostics, but we go beyond that to the process of care, because that can also, be simplified and make sure that we're leaning in to catch those things diagnostically. And a lot of times those are missed. So that's kind of the theory. Those are a few examples. And I think there's a lot to cover beyond that. If you just focus on what you can do to live a long time, you can't live a long time if you have any of those diseases. You have to catch them early, and you flip it on its head. If you catch cancer at stage 4, it's a 90% death rate. If you catch cancer at stage 1, it's a 90% survival rate. It is absolutely black and white. So if we manufacture that patient into a healthier version, and we continue to optimize that patient, continue hormones, continue to do whatever works to keep muscle mass on, there's longevity in there. And there's a process of care that really can deliver change and change the lives of the people, right? I think that's the motivating factor for me.
So, when the audience goes to seedhealthcare.com, they can see the actual companies involved and they can get more curious and investigate further, right? So,
They can. They can even reach out to me. I've had many people on either LinkedIn or social media reach out about what tests I take, where do I go, what alternatives do they have. Of course, I'm an investor in some of the companies, but there's plenty of companies that you can get these tests at. And I would just say you have to motivate yourself and get past that fear of the unknown of what you're looking for, and know that you could do something about it if you catch heart disease, right? You can do something about it if you catch cancer at stage 1 or 2. Harder to do something about it at stage 4. Harder to do something about it if you have a heart attack already. You have cardiomyopathy and other challenges to deal with later. So for me, it's all about proactivity. And when I'm speaking, I'd say half the time I'm talking about investing, fun, things like that. The other half, and if I have a room of 100 people, there's probably 14% of those people have chronic diseases they don't even know they have. So if I'm creating awareness that they should actually go find some way to test for it and screen and find out if they have it so that they can actually do something about it, we're going to save lives. And so part of my mission is to have those conversations that sometimes people don't want to hear. They keep their head in the sand. They're worried about what they might find. And for me, I'm worried about what I might not know, right? It's kind of the opposite. And I don't know which side of the camp you're on, but I think information is power.
So I'm curious then, where do you see the consumables? The consumer products like the Apple iPhones, the rings, the watches, and their capabilities. Where do you see that going? How is that going to be preventative in the future? Or what are some things you're excited about? And then what are some of the other things that you see that you're excited about? Let's deal with some of these consumer devices as they're continuing to evolve. Or do you think they're that useful, and to what extent?
I'm wearing an Oura ring, okay? And I think the data, so there's a theory, right? If you can't measure it, what can you do about it, right? And the data that's coming, that we have now is good, okay? The data that's coming is going to be exponentially better. So for me, I think that the consumer side of it, where wearables are going to help determine some of those things today, they could say, oh, we could infer whether you have heart disease risk. My Oura ring gives me my biological heart age is 12 years younger than I actually am. So it makes me feel good, okay? But it doesn't necessarily tell me that I have heart disease or not. You could still have heart disease, so you still need to look and you still need to do. But I do think that there's a role for wearables. I think eventually we'll walk into our houses and it'll say, oh, Todd, your temperature's elevated. You need to take a break or whatever, go do a breathing session or something like that. I think the technology is getting better and better. And I think that all the big companies, whether it's Apple, Samsung, all of them are chasing how to really interact with the patient or the human, and take data and use it. So I'll use an example of one of our companies, Fountain Life, actually takes all my wearable data, it correlates it. And if I had a CGM, a continuous glucose monitor, I try not to use acronyms too often. So for everyone else, if you don't know what a CGM is, it's a blood glucose monitor, and it will interact with your sleep and your record of like where your cortisol levels are, and you'll measure your heart rate, and it'll start to really discern information around your sleep and what might be disturbing it, including your blood sugar spikes or any of those types of things. So when you start to see that data convergence where it's multimodal, it starts to get really powerful. You can only get so much from your finger, but you start to pull in other data, and then you start to pull in activity data and then multimodal screening data. You can really start to discern where to go and be ahead of your healthcare. And to me, I think it's an exciting thing to watch. I think that the tech is coming. Some people love everybody's got their favorite, right? I personally love my Sleep 8 or 8 Sleep because I like, to sleep like a polar bear in cold, so I make it like 62 degrees, and do that. So all of those things are good. And I think in the near term, I'd say within the next 5 years, you'll see them be really integrated. I was just talking to a friend of mine who worked with SOCOM in the military. And I think you have a lot of tie-in there. And they actually implemented an Oura Ring, program for all the Navy SEALs. So they could talk about their readiness. And so you're starting to see it get more adopted as the data gets more sophisticated. I don't want to just lean into Aura, but there's a lot of data tools that measure a lot of good things, and I think they're useful.
I guess the key, though, is to take all the multimodal data sources and be to have it interpreted for you somewhat, to at least give you some indication of what these things mean. Of course, you always have to be overlaid on your clinician. So, we're not keeping the doctors out of the loop. We just want to, it just guides us, and then we can take it to a doctor and say, hey, this is some of the indicators. What do you think? And then where do you see that interpretation part of it going? How do you see the regulatory aspect maybe impeding that? Or do you think it's going to open up a little bit better?
That's a great question.
A lot of people are using ChatGPT, right? They're using their Anthropics or whatever, and they're doing their own kind of investigation. And where do you see that going?
I'd say, let me frame this the right way. I'll frame it the way I think about it. If I walk into a doctor's office and he's wearing a stethoscope and he actually uses it, that's fine, okay? But if he's wearing a stethoscope, but he hasn't read the 2,300 journal articles that were published today, okay, 2,300 a day, roughly, just plus or minus. If he had to read those to discern how my health should be evolved, how is that humanly possible? It would take him 20, 28, 30 hours in a day to read and keep up with all the journal articles. And everything changes from the time doctors get out of medical school. The information they were taught, they have to stay up on, right? And then, there's just so much coming at them, peer-reviewed journal articles. There's just so much information, right? And today things are changing even faster. And there's this huge medical latency gap because physicians aren't comfortable making things the standard of care until they get really comfortable with something. It's 17 years typically from the time innovation happens to the time it becomes the standard of care. So I'm framing this up a bit because to me, we have to close that gap. Technology is changing in minutes, not years, right? Like we're seeing it transform before our eyes. And if you have a doctor that is not leaning into technology to enable their care delivery, I'd be a little scared of that personally. I think that the doctors that are leaning into adopting interpretive data tools and resources, they should be using scribing type of tools that are writing down their notes so that they're not missing things. And, if you look at the way data systems were being used in hospitals and still are, it's a billing event. It's a documentation around a billing event instead of a care delivery process. And when you start to converge all the data that's available, you can actually take tools. We're seeing some, we've invested in some, and we really believe that the convergence of multimodal data, including genomics, including wearables, including your screening tools, including scans and data, images, virtually everything in your medical record and your EHR and billing data should all be relevant to a longitudinal perspective of manufacturing that patient to a healthier version of themselves. And if you do it the right way and the doctor is in the loop, you're able to really kind of motivate and move that needle where they can actually be communicating with the patient around the care delivery in a much more intelligent way. And I find that the doctors that are embracing that and the groups and the practices that are embracing that are going to be really way ahead in patient care, outcomes, and all the things that matter as we continue towards the latter part of the 26, 27, and 30, when value-based care becomes really relevant to the elderly population. So I think it's time that tools are used, right? That's my opinion. How do you see it?
I mean, sort of the medical profession tends to be perhaps a little bit more, much more cautious. So I they tend to maybe lag in the adoption of some of these things rather than lead, right? So that's sort of the impression I get. And but I think things are changing. There's a movement to, because consumers are coming into the medical office and saying, I've got these things and I ran it through my little thing, and what do you think, right? So,
Right.
uh,
Well, the doctors may come along kicking and screaming, right? Like, because their patient's going to know what the interpretation is through that. I mean, put it this way, a doctor friend of mine took his full genomic sequence, like every aspect, and the genome has been a mystery that it was discovered, and now we're discovering new things about every strand, every minute of every day, right? And if he actually took it and he ran it through this AI methodology, and it literally broke down his genome into pieces of what would influence different aspects of his health and what to look out for. Now, your genomics is, I'd say that, and people would argue whether it's, 20% or 30% hereditary genomic data that would determine your outcomes versus, say, 70 or 80% environmental. I think we do a lot of harm to ourselves, and we have to environmentally get off the couch and fix those things. And you can overcome some of your genetics based on your environmental delivery in that. And so, but the information that you have from that is know what you're predisposed to and know what you're actually working to resist, well, whether it's metabolic health, heart disease, any of the big ones that I've talked about. And you can extend your life and lifespan and your quality of life by extraordinary numbers. And so the data, and he took all of his genomic data, put it into AI, and it gave him an extraordinary analysis of it. And that's not a product. It's just using an LLM, which, I think it'll become productized and it'll become more sophisticated, where you're able to train the AI on what you're doing. And some of our companies are doing that. And the more trained the AI is on the specific application and the specific articles, I mean, like the microbiome, it's a mystery to many scientists, and there's new peer-reviewed journals every day. And unless you're harnessing all of that research, you're not really leveraging the true power of the technology. So I'm a believer. I believe that we should be, driving towards that innovation really fast. That's my opinion.
Well, you indicated there's 2,300 new journal articles, and there's no way a doctor can keep up with it, or anybody can keep up. You're going to have to use some kind of assistance, right? There was an earlier trial that Microsoft did with their AI diagnostic orchestrator, and they used a chorus of LLMs to represent doctors to kind of debate, and then they had a panel of real doctors. And they took 304, and I'm just going from memory, so I want the audience here, you do your own research, but they got 304 of the most difficult cases in New England Journal of Medicine, and they said, okay, see what you think. And the AI scored 85%, I think it's like 85.5% on kind of accuracy, and I think the doctors are 20. And you had the ability to kind of order a potential tests in this trial, and it was 20% more efficient as well. And so, and this is just the first implementation of what the possibilities are. And that's because these things can see everything, right? And
they can. Well, and each one is trained a little bit differently on each. I think it's interesting that and I've met a lot of people at Microsoft as things have developed, right? With Peter Lee and the group over there, they're great. And I'll tell you, one of our companies does kind of that within the background. So when their doctors are doing a differential, it has 3 different LLMs fighting with each other to create the right answer. It's a little slower, right? But it is much more thorough when the final answer comes out, because you're looking at the patient's data, you're looking at the public journals, you're looking at all the material, and you're looking at it from 3 different angles, and it comes back together as one answer. And I think it's a very good, powerful kind of methodology. So I think that's a smart move for Microsoft.
Yeah, I mean, it's just remarkable, all of these tools coming out. And so where do you think this is going to be in 5 years then? Do you think that there is going to be a clear integration between us and clinicians and LNMs that are kind of working together in an active, proactive way, and it'll just be seamless, and it'll be normal? It's just like if you went back 10 years and described how we use AI today, people would have thought, hey, this is AGI, right?
Yeah.
But now
They
people
thought it
just,
was crazy.
yeah, they would have, yeah, precisely.
I would say 5 years from now, we should see real integration, and that I don't think the doctors will be disintermediated. I believe that you still need a doctor in the loop. As you know, I don't know when that changes. It may never change. It may, CMS may still require it for billing purposes, whatever it is. But the idea of integrated data systems and tools, I think we have to be there in 5 years. If we're not, if you can't, an EHR right now is just a one-time event, and it does not build on a patient record. It does have information in it, but it's not interpreted and used. It's basic H&P. That's why you go to a new doctor, they do a full-on new history and physical conversation, and they ask you all the same questions that you got asked at the last doctor's office.
Right.
And that shouldn't happen anymore. I think we should get to this kind of seamless state of the information being more available, and your information being in your own control, to where you can actually hand it to the clinicians and not have to answer all those questions. And then the AI actually being, a conduit to the interactions with the physicians, so that, the time can be spent more meaningfully in driving the right outcomes, instead of focusing on answering a million questions that you don't already have that should already be answered, right? So I think 5 years from now, we should see that in at least a big movement towards that direction. And full adoption, if you look at, I've kind of circled 2030 for a lot of reasons as massive movement of change in healthcare, because Medicare is the largest insurer in the US, okay? And they are mandated to shift to a full risk model where the doctors are rewarded for good outcomes and paid for that based on taking care of the lives of people that they're assigned. Well, if you think about that, that totally flips it on its head, right? So the power has to be there. How do they know what's a good outcome if they're not leveraging every data source and every resource to really kind of drive that? So I really think 2030, and they may move the mandate governmentally, you never know what's going to happen. If you had told me where we'd be this year in the US, I would have told you you're crazy a few months ago, but it is what it is. So I won't prognosticate there, but I will say that we should see a big movement in technology adoption in healthcare. There should be no reason that this democratization movement of getting the tests that should be done for people instead of doing inferential diagnosis should be, pushed down to really democratize it and make it available at a much lower cost than it is today. And I see that as being a huge value to the world, right? I mean, that's what I'm really trying to do, is get it democratized to people. And if we can get the sick care system to come along with us in preventative care, which they're going to be forced to in 2030, I think we're going to be able to really move the needle significantly.
Do you find that you use like some of the, the Pro models, the Ultra model, which is there's the 250 US from Gemini, there's the OpenAI, they have the Plus, but then there's the 200 Pro models. So you see this shift to the consumer where you have this higher price models. Is this something, or you may not want to disclose, but is this something you kind of try to consume, or you tend to go for the entry ones that are out there?
I know I'm paying for a bunch of AI.
Yeah.
Oh, like, and again, you know it's going to become democratized as well. I mean, look at OpenAI's latest release. Now they made what I was paying for before free to everyone else. And,
Right.
uh, I think that it all depends on your volume of consumption and what you really need. Um, I'm one of those adopters that I think it should be embedded into the fabric of how we do business, how we interpret. But I still think we need to use our brains and be the human in the loop, right? And so I think we can automate things and do things that we couldn't automate before. But I just don't think it's quite there on full movement towards displacing the human interventions. So I believe that I'm like, I'm thirsty. I want it all. People are scared of it. And
Right.
like, I don't know where you stand on that. I think we even talked about this on our podcast. Um, some people are building bunkers and, putting, non-perishable food in there and not, like their weapons and all this stuff. And I'm like, I don't think that's where we're going. We are human. We like to live. We want to live. So I think, we might get close to world destruction, but we probably will bring it back a bit. And I'm more of the optimistic version of it, meaning I think if we can use it for good and we can really use it to move the trends in the right direction in creating a better life for people, better outcomes, and even more jobs, even more opportunity, and even more company creation and innovation. I think I'm on that side of the camp versus death and destruction. So I don't know. I don't know what your thoughts are, but
Well, it's interesting. I did an earlier interview with Bob Langer, and he was describing this interaction he had with Reid Hoffman. So this will be public because he discussed this publicly, but he talked about Reid Hoffman, and he sent him a book, and he's in the book, Reid Hoffman's book, but he also described that the book talks about, every time there's a major innovation, people are going, oh my God, the world's going to be in trouble. It's like when we went to cars, they thought that was going to be a huge disruption. And then you end up you acclimatize to it, you create new jobs, and yeah, there is change, but it ends up, society's being better. So I guess he's written this book where he describes all of these kind of changes, and it works out, right? So
we get close to the world destruction, then we bring it back, right? Like,
yeah, exactly.
like I don't know. We like to live on the edge here sometimes, I guess, and in the world. Let's hope we don't get too close to the world destruction, but I think it's a compelling discussion and very relevant in healthcare because if you could just like the days of the Jetsons, or you can call it whatever you want, whatever the sci-fi movie you want to talk about, something that scans you and says you're good, you're not good. I mean, I want all that. I want to know, like, and to me, I do that today in the scans that I amass, and every time I go to my clinician once a year, it's about 200 gigabytes of data that they upload. And if you think about it, that's a lot of data. And it won't nearly need to be as much data, probably a number of years from now to get the same answers. But today, that's how much data it takes to eliminate the big risks. And frankly, I think everyone should have that opportunity so that you can actually have peace of mind and go work out, go do the things that you can create real proactivity with. And motivation comes from that. If you're healthy and you don't have those risks, or you have those risks and you need to reverse them, it's even more motivating. I find people can't really get off the couch and say, oh yes, I have tangible heart disease until they actually see the arteries and what's inside them. So it is motivating, and I think we should all be consumers of that if we can be.
So we just have a couple of minutes left, and what final recommendations since you're really the audience, Todd, and maybe you want to post some questions for them to ponder.
Yeah. Oh gosh, recommendations. I'd say the first one. This is and this I wouldn't be accomplishing my mission if I didn't kind of put this out there. Make sure that you take a comprehensive look at your health, okay, and how you do that, and the data that you can amass. You can go get the tests I get. Everybody can go get them. They're not that expensive. It's just how you assemble them. And I would say if anybody wants to reach out to me, they can reach out to me, and I will give them a list of tests that they need to go consider. And those tests are attainable. They are available at almost every hospital, every imaging center, all of those things. And I would just say, know that if you go get one type of scan, that you're not eliminating all the risks. So if you go get a CTA, you're really focusing in on heart disease, which is a CT angiogram. If you focus on an MRI, which could be, say, a Pernuvo scan or something like that, which is a good MRI, that's for eliminating masses and irregularities like aneurysms and those types of things. And that's a good test, but that's one test. You need a combination of them all to kind of get the full data picture and eliminate the big risks. And so my number one urge for everyone listening would be, don't sit on the couch and keep your head in the sand. The data is out there. Learn and don't be scared of it. Go actually embrace the data and be able to do something about your health based on that data. So that's number one. And that's the kind of what I would call people to do. Second part that I would say is that, it takes a village to drive change, and that's what we're doing, right? We're investing in preventative care. I think that the U.S. government is kind of coming along. I think a lot of the governments are investing in preventative care. They're starting to, and they're becoming more aware. They just don't know exactly how. And I'd say that how is something that I think, is a movement of change, right? The more we're an example, the more we drive change, the more we invest in technologies that can change the delivery of care at the point of care, just like you're suggesting, the AI in the loop with the doctor in the loop, right? Where it complements and fits together. I think that's our mission at Seed, and we're doing a pretty good job of it. And I would just say if there's it takes a village, takes all hands on deck to make real sustainable change happen, and we welcome that in our community. And feel free to have people reach out to me if there's interest in what we're doing.
Well, the thing is, people can go to your website at Seed Healthcare, and they can look at where you're making the bets, and you've done all the betting. So there's some advantages there, right? You're at the frontier, you're looking at the things that are working, and you're making the bets, and people can use that to advise them of where they want to, do their own preventative care. And so, just a marvelous narrative that you shared with us, all of these insights, all of the experiences, and you're continuing to do that. So, Todd, thank you for coming in and sharing so much with our audience. It's so very practical as well.
Simplify complicated things, right? We have to somehow. Thank you, Stephen, for having me on. It's been fun conversation, and again, I think that the world of you and want to help you however I can as well. So appreciate the opportunity.
Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.